Right, welcome back. Now, this morning we want to talk about today is World AIDS Day. So we want to put this matter into perspective. And already from the comments that I'm seeing on Twitter, they're using the hashtag for breakfast. Many of you are asking what the statistics are now, and of course, again, like we saw in the online brief, there's a lot of talk about marginalized groups. So I want to find out the situation so far, and as well as encourage you also to know your status. It's very important. And we're talking to Dr. Nduko Kilonzo. She is the director of NACC or NACC, and she'll be here with Muteki Jao. So if you have any questions, views, and comments on this, the number to use is 2242. That number again is 2242. Talk to us with your questions, views, and comments. Of course, do not be afraid. We will have this conversation as open as possible and as educative as possible. So get texting on 2242, and on Twitter the hashtag to use is Power Breakfast. Muteki?
Karibu Daktari. NACC means National AIDS Control Council.
Yes.
That's why you are Chief Executive.
Yes.
Well, I've seen some alarming statistics, but before we get there, AIDS has been here for how many years now? From 80 something?
Yes.
How many years?
30 years.
30 years.
Yes.
Why? People think people die of malaria, not AIDS.
I think
what is the bigger killer, AIDS or malaria?
I think it depends on what group of people you're talking about. If you look at in Kenya and in sub-Saharan Africa, adolescents and young people, AIDS is the #1 killer. And when I say AIDS, I mean people who have HIV, whether they have acquired it or they were born with HIV and have then not been on medication or have stopped taking their medication and therefore developed opportunistic infections that eventually kill them. So it depends on what group of people you are talking about across particularly in Kenya, because we have different age groups, different types of populations. So for instance,
people probably have forgotten about AIDS. You are the one talking about it. Because I remember when I used to work for Nation, there used to be a group of people there who were HIV, and they used to meet and do counseling. In this company, I don't know whether we have a group like that. And I don't know whether many companies. There was a time when companies used to talk about AIDS. These days,
I think there is two issues to consider. When HIV and AIDS first, came into the world, into Kenya specifically, for a long time, AIDS was always considered, a HIV positive status was considered a death sentence because we didn't have medication, we didn't have ARVs. And over time, we've had a lot of people. Currently, Kenya has about 850,000 people already on ART treatment.
850?
Yes.
About nearly a million people.
That is the target. So on ARV treatment, and ARV treatment is daily ARV medication. And so we are in a place where we have seen less and less of infections, co-infections that are related to HIV or that cause AIDS, and then increasingly there has been less and less discussions about HIV. So there's actually a generation of young people, and that's why we are focusing a lot on young people now that do not understand HIV as you've said, as you know it, because they have not been brought up in that era, or they've not grown up knowing that AIDS is a disease that has killed or can kill people if people are not tested, don't know their status, if they are not on medication. I think the other thing is we've done a lot of work around prevention and around reducing stigma, and I think those are the gains that we have made. So for instance, if you look at children, mother-to-child transmission rates have fallen by more than 50% to less than 13,000 from the report of last year. So we've made significant efforts over the last, and that's over the last 6 years. If you look at HIV prevention, or even just prevalence, the measure that we use, at some point we were talking about a 12-14% prevalence. Now we are at a 6% prevalence. So I think prevalence means the total number of people living with HIV over the total population.
So do we have less people or more people?
We have more people living with HIV because less people are dying, but we have less new infections than we had 20 years ago.
Less numbers
of new infections. because new infections are really what we look at to see how well we are doing and as far as HIV is concerned. Because HIV, the new infection is, someone who is HIV positive infects someone who is HIV negative, and that is a new infection into that adds to the number of people living with HIV.
I think it's last year or this year, there are people who are complaining, those who take ARVs. I think the Americans threatened to withdraw their support. I read in the newspaper today that American ambassador says he's going to give us new projects to fight with it. Is ARV available to, you are saying, mere 800,000 people?
850,000.
Is it available to whoever wants it?
Yes.
Every corner of Kenya?
Yes.
Where?
In all health facilities. Health facilities have HIV care clinics. And let me just start by, you've mentioned a point. I think I want to say that the government, the US government, had never at any one point threatened that they will withdraw the use of ARVs. I think that was not correct.
There was a time there was shortage.
Yes, but there may have been, in terms of a stock out, a pending stock out, but we never really had a complete stock out where medicine was totally unavailable. So there was a bit of rationalization. However, currently we have complete stocks for the country. We do not have any shortage of ARVs.
And they're free?
To the client, to the person who is taking ARVs, yes. I don't say yes automatically because somebody does pay for them. And currently we get donations obviously from the American government. We get from the Global Fund as a country through the proposals that we write forth to the Global Fund. And I think we also this year, the government of Kenya put in 2.6 billion shillings that has gone into ARVs and other HIV-related commodities for HIV. So it's everybody pulls in so that we end up being able to ensure that we have test kits to cover the country and ART.
If the ARVs are there, then why are people dying?
Very good question, because I think I tend to tell people that HIV starts and ends with behavior, and everything else is in between, because the ability to get up and test and know your HIV status is important. From our AIDS indicator survey of 2012, we know that we actually were in a place where almost 40%, 47% of those who were tested HIV positive did not know their correct HIV status. So we still have a lot of people who do not know their HIV status. And sometimes we assume because I was tested 4 years ago, it is still my HIV status today. And therefore, the whole idea of testing, at least annually, is important. The second thing is, even when people know their HIV status, we have the question of willingness to take medication, but also the question of stigma and discrimination. Let me take an example of young people, because you started by asking me young people. Young people, part of the biggest challenge with being able to disclose their status and take medication is fear of stigma and discrimination from their colleagues, other young people, from the school system, and from communities. I'm sure you've had stories where children have been told, don't play with so-and-so's child because atakupatia ukimwi. And those are things that promote stigma. So you find people may know their status. And for young people, especially as they become adolescents, they're dealing with identity crisis, all the things we know adolescents have to deal with. So when they also have a HIV positive status, it becomes challenging, and it is always not disclosed to them. Sometimes they're told they're taking medication for different things, vis-a-vis being told that they're being given medication as ARVs. And then finally, there is stigma and discrimination from the community. So we find that there are people who know their HIV status, they are afraid to disclose to their families. They'll be told, you know, you're the one who brought HIV to our family, or this has happened because of you, or you're disinherited. So there's a lot of things that are about behavior, about social behavior, about individual behavior that go beyond just taking ARVs. And that's why for our role as NAC is to ensure that while the Ministry of Health through its service delivery agency of NASCOP provides medication, we are dealing with all of the issues around stigma, around discrimination, around disclosure, around working with the networks of people living with HIV, who I think have been very significant in ensuring, in helping the gains that we have made.
That business of adolescents is very scary, because in a school, say in high schools, if a boy or a girl has got AIDS, everybody, it is not like having a wound which will be tied so that people will see you are sick or having a cough. How do you deal with the school systems in terms of counseling and dealing with other students to accept that person who has that problem, the challenge?
I think, let me start by saying that we, over the last 4 or 5 months, we have had significant work between the National AIDS Control Council and the Ministry of Education. The President in September this year launched the Fast Track Plan to end AIDS and stigma among adolescents. And that was really a collaborative effort between the Ministry of Health through the National AIDS Control Council and the Ministry of Education. And the whole idea is that we have set out targets, and the Ministry of Education is committed to providing the resources to be able to sensitize teachers, sensitize schools, provide training for counselors and matrons that goes beyond sensitization, because even things like where you keep your medication, how you know that that child is not suffering any form of opportunistic infection, basic medical care that is available even at community levels or at homes to people who are living with HIV positive is not necessarily available in schools. And there's already campaigns right now, and we are already in the middle of currently with KICD working on reviewing the Kenya Institute of Curriculum Development, reviewing the HIV curriculum so that it actually is in tandem with where we are today. So where we are at right now is there's been plans, there's been progress that has already started with activities that have been happening in the last 2 months.
If I go to a school nurse, in a normal school, normal girls or boys high school, will I get ARVs? And are they provided there in case there are students who need them?
No. That's not the point. You don't want to avail ARVs as if they are over-the-counter drugs. No. You want the
how will a schoolboy or schoolgirl who needs them get them?
You want them. You want one. First of all, the child has to get them from the facility, the nearest facility. And so
the nearest facility means skipping classes.
Well, it happens for often. What is required is a quarterly visit, one visit every 3 months, to be able to do your bloods, as well as to be able to provide or get your replenishment of ARVs. And so what would happen is that for most of the people, by the time, if they are coming to secondary school and they are already HIV positive, that is where it is introduced to the school system. And that's why I said that we are now working with the education system. The targets have been set, resources have been put aside, the training curriculum is already being reviewed. And then nurses and matrons and counselors will get extra training beyond sensitization, because they really are carers, so that the nurse can know this student is positive.
I thought you should tell me they have been.
It's not been, and that's why we are focusing on adolescents and young people. Over the last 20 or so 30 years of our AIDS response, I think when we started it was an emergency, so everybody was really focused on how do we even get people tested, how do we get medication, and also we didn't have as good data as we have today. Now that we have data, we are able to disaggregate, and it is in the last 1 year we have realized that adolescents and young people up to the age of 24 have been left behind in the response.
In that case, therefore, are we getting, it's supposed to be voluntary. Why can't we say every schoolboy or schoolgirl be tested?
Well, because, as you say, it is supposed to be voluntary. I mean, it is, even if you tested everybody, unless they were able to accept their status voluntarily, unless they were able to take their medication. We've known people who've taken medication and thrown it away, as you heard recently from other media stories in other areas. So mandatory testing is not the answer. Not only, does it contravene basic human rights principles, but it's not the answer. It will not get you the results that you're looking for.
According to statistics, 9,720 adolescents or young people died of AIDS 2 years ago. Every day in Kenya, 30 adolescents and young people are dying of AIDS. Every day in Kenya, 72 adolescents and young people get infected with AIDS. These are very scary statistics. And what you're saying is like it's not enough to stop this. This is very scandalous.
I agree, it's an epidemic, and that's why I think the question that you asked about we never do much about HIV anymore, and that's a responsibility of all of us. It's a responsibility of communities, it's a responsibility of companies, it's our responsibility to keep talking about HIV/AIDS. I think these statistics just tell you that the fact that we have talked about it less, or we are talking about it less, does not make it go away. In fact, if anything, it just covers up a problem and a crisis that we may have. And I say crisis in the context of the numbers of new infections. We had about 100,000 new infections in 2 years ago in Kenya. And of those 100,000, 13,000 were children born with HIV, 88,000 were adults. Of those 88,000, 1 in every 3, which is what accounts to that 72, were people aged between 15 and 24 years. And so what we are saying is that HIV is not something that has gone away. It is not something that we can keep quiet about, and it is not something that we can assume no longer exists or is no longer an issue. We must continue, and we would like to ask the media to keep really putting up the fact that it has not gone away because we have ARVs. There is still, we've made tremendous progress, but there is still a long way to go.
I see people with companies organizing vaccinations like hepatitis B. They go to a vaccination regularly. Why can't we have tests in companies? The voluntary tests, they come here. For me to be tested, I must walk to some establishment. For these young people who are working in this company, for instance, why can't we have you or whoever who does the testing come here one day, a company, and say, we'll be testing people here on Wednesday or some other day? Why is that not happening?
Actually, what has happened is that increasingly where we have had the requests from private sector companies, that does happen. However, as you know, there are very many different and very many companies, so it's often on a request basis. It's not more like us saying, we will come to your company on this day to provide testing. But perhaps that's the challenge that we need to figure out. Exactly. That's what I'm saying. Perhaps that's the challenge.
Request.
Yes.
What the companies, obvious, some HR people, they know workforce is important. So they'll care for their welfare.
Yes.
But then some other companies, they just want bottom line.
Yes.
You work hard, you work for your 10 hours or 12 hours, you go home, what happened to you, they don't care. In that company, they will never invite you there.
Yes.
They will never call you to do the test.
Yes.
Why can't you offer?
That's what I'm saying. I think that's a challenge to us, that we also look at our model so it stops being particularly for the private sector. In many other places, I think we tend to be more proactive, but for the private sector, we tend to ask. So we would definitely look at whether we can devise a different model. Because in the early days of HIV, if you remember, there was a lot of private sector people coming up and getting tested, and therefore the private sector was actually really taking the lead in HIV testing and counseling. Over the years, again, that's why I keep saying we can't forget HIV is still an issue for us.
Prevention. There used to be something called ABC, which was, maybe young people don't know what is ABC.
Yes.
When I was young, we used to say ABC.
Yes.
Abstain,
Be faithful or use condoms.
Yeah.
Yes.
Abstain is not the language of young people. Faithfulness is not the language of young people. Maybe condoms, they understand. What is the situation about the supply of the condoms?
Condoms are available. We still have
there was a time I used to see dispensers all over in every public place.
Yes.
They are no longer there.
They are no longer there, but they are coming back. Because we
Why did they
realized...
disappear? That's why you're having these kind of statistics.
Well, I think, again...
I should expect in the washrooms in the company like this,
yes,
there must be dispensers there.
Yes.
They are not.
Yes. Again, it comes back to the question of the amount of advocacy and information. And also, during the early days of HIV, we were all scared of dying. So even companies were making it their business. Bottom line meant that they had to do work on HIV. With ARVs, that is not necessarily the case, but we forget the silent issue, which is prevention. And so that is why we have also now come out and we are beginning to infuse back the conversation into the public discourse that actually HIV has not gone anywhere, that it is still an issue. Because I think over time, two things happened. One is we all concentrated on scaling up ARVs, which was necessary because we have a lot of people who needed to be on treatment. And so somewhere along the way, we also then reduced the numbers of deaths and the numbers of people who were actually sick or who had opportunistic infections. And by doing that, we then had a situation where even companies stopped seeing HIV in their faces, and so the dispensers, nobody took care of them. So we are beginning to also provide these statistics, give this information to say this is an issue, it is a significant issue for us. And maybe just to say it's not just a health issue, it's an economic issue. Yeah. Because just to think about the cost of HIV into our future. We are talking about the next 50 to 60 years of ensuring that people who are on medication are treated, because if there are children today being born with HIV and they will need to be treated for the next they have a life expectancy of 60 years. It means that they will need to be on medication, even as the AIDS vaccine initiative, the Kenya AIDS vaccine initiative here is doing a good job of trying to find new vaccines.
Somebody is complaining about tendering in NSCC, and which I think is not what we are discussing about. Maybe you can read it later on.
Okay.
But
okay.
We have talked about stigma in the schools and all over the place. We used to see, you have told me, people who children who may have AIDS. First of all, distinguish between HIV and AIDS.
Yes.
Yes. So that people know the difference.
Oh.
So that stigmatization might you deal with it.
Okay. HIV is a virus, human immunodeficiency virus. And when someone acquires that virus, then it suppresses their immune system, the ability of their immune system to work. And the immune system is what gives you prevention from other diseases, from other illnesses. And when your immune system is not working, you become very susceptible to all manner of other diseases. So whether it is what we call opportunistic infections, diseases of the skin, TB, we have many diseases that really flourish when you have a depressed immune system. And therefore that depression of your ability for your immune system to act causes you to have opportunistic infections, and those are what we call AIDS, acquired immunodeficiency syndrome, those infections, and those are what kill. So the virus itself, if controlled, does not kill, and that's what ARVs do. They control the multiplication of the virus, and therefore means that your immune system is able to keep working.
There is the issue of, according to these statistics, you say Kenya has the largest, Kenya has the fourth largest HIV epidemic globally.
Yes.
And you have told me, does it mean if you are HIV, you are sick?
No.
So what does that mean?
We have the 4th highest number of people living with HIV globally after South Africa, Nigeria, and India. So those are the 3 countries that have a higher number of people living with HIV than Kenya. We have 1.6 million people living with HIV, and therefore that's why we say we are the 4th largest HIV epidemic. When I say epidemic, it just means that we are talking about the fact that the disease is in the population. Yes.
What would you tell Kenyans about young people?
Yes.
They have seen you make recommendations. I don't know, I've told you about ABC. What are recommendations now you tell young people and adolescents? What do they do?
The first one is know your HIV status. Get tested. Know your HIV status. We have forgotten that song. I remember as you said, you remember, we used to, everywhere you went, it was know your HIV status, know your HIV status. So I think that's a song we must re-engage in. Know
Which
your
means
HIV
you must
status.
walk to a place and be tested.
Yes.
For free.
Yes.
Is it for free?
Yes.
There are hospitals, if you go to some hospital, you'll be charged 2,000 bob.
I think there are some private hospitals that charge.
They charge 2,000.
Generally, if you go to any public hospital or any VCT site or any VCT center, you do not get charged for testing and counseling. The second message then I would like to tell young people is it is your responsibility to ensure that you are preventing yourself from getting HIV. One, you need to know the facts. Only 51% of our young people actually know HIV prevention. From the Demographic Health Survey last year, what we found is that 99% are aware of HIV, but only 51% have comprehensive knowledge. When you start to ask about HIV transmission and other a composite of about 4 questions, then you find that only 51%. And therefore it means that we are not providing sufficient information. So young people need to actually go out of their way to find information, but also we have a responsibility. And when I say we, I mean NAC, and that's what we are doing now, recognizing that knowledge is not at the levels that we found for HIV prevention. The third is for those who are HIV positive. Get your medication and adhere to medication, because without medication, that's where we end up having AIDS deaths. And I think the 4th one is that we all must stop stigma and discrimination, of HIV-related stigma and discrimination. And until we do that, HIV will continue to be an issue for us as a society and as a community.
What about the parents?
Parents, know your HIV status, yours first. Secondly, encourage your children. But thirdly, find out what your children know. Teach them about matters of sex, matters of sexuality. For the very simple reason that if we are not doing that as parents, the internet has taken over control of what our children know. And the internet has, well, both good and bad information. It has the range of all the good information you can find, but it also has the range of information that can really mislead young people. And therefore it is important that parents are actually making it their business and not leaving parenting and control of information entirely, and particularly sexual information, entirely to the internet and to peers, because that often results in information that is not accurate and often incorrect.
There are some religious organizations and who do not believe in those things. They only know something about A and B. They don't know anything about C, and they completely refuse about anything to do with C. They are not for.
I think we need to be cognizant of several things. that one of the biggest debates in Kenya has been, are we doing condoms for schools? And we are saying no. However, we need to be cognizant that, for instance, between Standard 8 and Form 1, we lose approximately 300,000 to 400,000 young people every year. They can't.
How many?
300,000 to 400,000, because
do we know that?
do. Yes, we do. Just look at in December. You normally, even in the papers, you normally say 800,000 did Standard 8.
Yes.
And in Form 1 in January, how many end up going to school? About 400,000.
They haven't not, they just not pass.
No, I don't say, okay, I meant lose from the school system. My apologies.
Yes.
Lose from the school system, meaning drop out. It's attrition.
Yeah.
These young people go into communities and they go into the society without skill, without information. Many of them end up either married, engaging in sex work, engaging in drugs, all manner of things for survival. And so therefore, as we start to talk about the question of condoms and young people, we need to be cognizant that we have a lot of mature minors. 70% of our pregnancies are in the ages of below 24 years. So we need to recognize that there are a lot of young people who are married at about when they are still teenagers, and who get then, who become adults, so to speak, or mature minors at very young ages. And if they are not able to abstain, and they are not able to be faithful for various ranges of reasons, those mature minors should have access to services that ensure or provide them with better sexual health.
Thank you very much, Dr. Nduku Kilonzo. We have run out of time, and I hope we could have talked more about even sexual workers, but we have no time.
Okay.
Thank you very much.
Thank you very much for inviting me.